As the global alarm over monkeypox outbreak continues, the first deaths due to the virus outside of Africa have now been reported in places like Brazil and also in Spain. Now remember, Spain happens to be one of the worst affected nations in this outbreak of monkeypox infections. Now, Spain's health ministry has reported its second death linked to monkeypox on Saturday. The announcement comes just a day after Spain recorded Europe's first fatality linked to the current outbreak. Now, Spain has also reported over 4,000 cases of the virus, and it is also recording a high rate of hospitalization at about 3.2%. Meanwhile, in Brazil, the local authorities have confirmed that a 41-year-old man died of the monkeypox infection. The reports also suggest that the man had serious immune system problems. Brazil's health minister had recorded close to about 1,000 monkeypox cases, mostly in Sao Paulo and Rio de Janeiro. And just last week, the World Health Organization had also declared the monkeypox outbreak to be a global health emergency. And at least about 18,000 cases have been detected outside of Africa since the beginning of May. At least about 78 countries have recorded at least about one case of the virus, with 70% of the cases having been found in Europe and 25% of the cases having been found in North America. Effectively, what this means is that 95% of all monkeypox infections that have been found in the last couple of months have happened in Europe and North America. Now, the impact of the COVID-19 pandemic on our lives has been far-reaching, and just when countries around the world thought that they were inching closer to a sense of normalcy, there is another cause of serious concern, and this is monkeypox. The World Health Organization has now declared a global health emergency over the monkeypox outbreak, and this classification is the highest alert that the WHO can issue. The global health body has said that there have been nearly about 18,000 infections of monkeypox from 78 different countries, majority of them in Europe and North America. So how worried should we be about monkeypox? Our next report gets you the details.
Let's now break down for you what we know so far. First, what is monkeypox? The disease is caused by the monkeypox virus. Now, it is similar to smallpox, which was eradicated in the 1980s. It is not as transmissible or fatal as smallpox. It occurs mostly in parts of Central and West Africa, and it is the strain from West Africa which is now circulating across the world. Let's now talk about the other aspect that is significant, the signs and symptoms of monkeypox. Like I said, they are similar to smallpox. This includes fever, headache, muscle ache, swellings, back pain, and lack of energy. Now, once the fever breaks, a rash can develop, often beginning on the face and then spreading to other parts of the body, most commonly the palms and soles of the feet. The rash can be itchy or painful. The infection usually lasts between 14 and 21 days. So how does this virus spread? Monkeypox can spread when someone is in close contact with an infected person. The virus can enter the body through broken skin, the respiratory tract, or through the eyes, the nose, the mouth. It can also spread by contact with infected animals like monkeys, rats, and squirrels, or by virus-contaminated objects like bedding and clothing. Just how dangerous is it? Most cases of the virus are mild. They sometimes resemble chickenpox and clear up on their own within a few weeks. In some cases, however, it can be more severe and has been reported to cause deaths in West Africa. The WHO says 98% of the cases outside the countries in Africa where the virus is endemic have been reported in gay men. And hence, they must consider reducing the numbers of new sexual partners. The UK Health Agency has also said that a notable proportion of recent cases in the UK and Europe have been found in gay and bisexual men. Outbreaks can be controlled by infection prevention. Vaccination against smallpox has been proven to be 85% effective against monkeypox. The WHO is recommending vaccination for the high-risk groups. It has cautioned that it takes several weeks after getting the second dose of the vaccine to be fully protected. So people must take other precautions, and until that point, antiviral drugs may also help. Wash your hands frequently with soap and water. The CDC advises people to exercise caution in situations where one cannot maintain some sense of personal space. The risk goes up in places like crowded areas and clubs. Potentially contaminated items like bedding, clothes should be kept separate until you have time to do your laundry. And in case you are actively experiencing symptoms or if you have come in contact with a potential carrier, the first step is to isolate yourself and prevent the spread, and then reach out to a healthcare provider who will determine if you should be tested. The WHO advises people to isolate themselves for 3 weeks from the time they believe they may have been exposed. And in case you experience all symptoms, here are some tips. Avoid scratching your skin. Keep the skin dry and uncovered. Clean the skin with sterilized water or antiseptics. Take a warm bath with baking soda or salts for lesions on the body. For lesions in the mouth, use salt water rinse. For now, monkeypox has been declared a global emergency by the WHO. Health experts say it is a significant act. They say it is a rallying cry for countries to take the virus seriously and not to be callous in their approach.
WION is now available in your country. Download the app now and get all the news on the move.